Our hospitals are desperately short of doctors and are relying on a network of overstretched locums to fill the gaps. Data obtained by 3 News lays bare staffing problems in every region. And doctors warn nothing will change until pay packets and working conditions finally catch up to other countries. Senior reporter Juliet Speedy has the story.
Managing with a shocking shortage of doctors is the new normal for our hospitals.
Our hospitals are in dire need of doctors. We are now seeing hospitals close and doctorless hospitals in New Zealand.
Wairarapa Emergency Department held together by locums.
So about 70% of our shifts every week at the senior specialist level are filled by locums.
It's a nationwide issue.
We're about 2,000 specialists minimum short, and a third of our graduates end up working overseas.
Shortages, once unthinkable, have become normal.
It's now the norm. Just like once upon a time, you didn't have such long wait times and you didn't have ambulance ramping. But these things slowly creep into the system and eventually you think it's normal.
These figures show just how many gaps there are. Gisborne Hospital has the highest doctor vacancy rate at 44%, while Southland Hospital has a shortage of 18%. In the table provided by Patient Voice Aotearoa, the term open to availability means an extreme need of one or more locums. And that's how Dargaville, the Bay of Islands, Ashburton and Gore hospitals are described, along with the emergency departments in Gisborne, Whanganui and Southland. The advertised need for locums in rural hospitals show Kaitaia will need 65 shifts covered over 6 months, and that Thames, Nelson, Oamaru and Balclutha also have shortages. In many rural centres, the highest need is in the emergency department. Whakatane needs 71 shifts covered in 3 months, while Masterton, Greymouth, Blenheim and Timaru are also doing it tough.
The answer is to pay our doctors more. We can't compete again on the international market, and because of that, we're not attracting doctors to New Zealand.
Australia's about double their remuneration. And it's not just remuneration, but it's also the work conditions. So if you're short-staffed, you're always going to be under the pump and work becomes less rewarding. And as a system implodes, it collapses like a deck of cards. So here in the last 10 years, I've seen loss of radiology, psychiatry, and last of all, and most important, was orthopaedics here recently.
Just 2 days ago, the government announced funding to expand after hours and urgent care across the country, with plans to recruit and train more staff.
We're investing a lot of money, a lot of resource into training more doctors so we can have access to those critically important services, whether it's in rural communities or urban communities, so they have those services.
I struggle to see how it's going to happen. You can't just magic up doctors to staff after our surgeries.
It's not addressing the core issue, and the core issue is staffing, and the only way to have staff is have good work conditions, especially when there are better work conditions just over the ditch.
He says doctors are not only working long hours, but understaffing means those hours have also become far more intense.